calls for masks comes amid coronavirus resurgence nationwide. Here in Arkansas, 564 new cases reported today. Again, Pulaski County leading the way with 78 of those cases coming from there. The state also saw a rise in deaths and hospitalizations as well.
Local leaders had quite a bit to say today about the status of testing in the state and what this means as we look ahead to the future. Our Jay Burr has more from Conway.
It was another day of a pattern that we've seen for a couple days now.
The Department of Health lab tests are going up. The ones that are going down is the commercial lab testing.
And beefing up testing capabilities for the state's labs is imperative to make up for that.
We are investing more resources in the Department of Health and to compensate for the reduction in the commercial labs and their turnaround time.
Congressman French Hill is wanting to amend the Defense Production Act to include medical supplies, ingredients, and compounds to help with supply chain issues because he says the turnaround times are also key to testing.
Because the key in business and the key in our hospitalizations and moving this economy is access to testing in a timely way.
Hill also saying that masks are also a vital part of the COVID battle.
Some of you may think a mask is inconvenient, but nonetheless, it is a critical strategy for our public health.
Despite a cumulative number of approximately 1% of Arkansas's population having contracted COVID, many would say that that's not a big number at all, especially with active cases well below that. Dr. Nate Smith says the Department of Health is still on high alert.
If you came into your living room and the curtains were on fire, you wouldn't say, well, that's less than 1%. I'm not going to worry about it now. Let's wait till it gets up to 2 or 3%. No, you get after it. And the fire is still burning here.
The subject of testing all students and faculty also asked about that. Dr. Nate Smith said likely too large of an undertaking for ADH, and also the schools differ with that.